Welcome to Monday's edition of COVID-19. I'm Min San-hee. The alarming and accelerated pace of the pandemic continues, paving the path to unprecedented numbers. The US, for one, has recorded 1 million cases in a matter of 6 days. Meanwhile, here in Korea, the daily tally has been hovering above 200 for the third straight day. We start the program now with our Kwon So-ah. So I'll just start us off with the situation here in Korea for this Monday.
Yes, Sunny. Along with the global situation, we are observing a change on the COVID-19 front here in Korea as well. We are starting off the new work week with an increase in cases, with 223 confirmed infections. And the number of domestically transmitted infections is also alarmingly close to 200. And that despite Monday's figures reflecting test results from a lower number of tests over the weekend. And as Sunny mentioned, we are seeing 3 consecutive days in the 200s here, and also we are seeing a steady rise in infections. And that makes Korea that brings the total in Korea to 28,769, and the death toll stands at 494, with 1 additional fatality reported in the past day. Now, if we go over to where the new cases broke out this Monday, we see a lot of regions in red here, which means those places with cases in the double digits: 81 in the capital Seoul, 42 in Gyeonggi province, and 10 in Incheon, which means the metropolitan region here has over 100 cases in total. And also Gangwon-do province is on high alert with 20 new infections, and places in the south as well are seeing double-digit figures.
I see. So given that reality, I suppose chances for a hike in social distancing measures are likely then?
Well, Sunny, that's what authorities are considering, as the numbers in certain regions already or nearly meet the criteria for 1.5 level social distancing measures. Now, top officials had some messages on Sunday to the public and calling for extra vigilance.
The government has issued a preliminary warning for Gangwon-do province and the Seoul metropolitan region, and is seriously reviewing an upgrade in the social distancing level.
The scope and speed of the latest wave is bigger and faster than the first wave. If we let our guards down, we could be struck by a vicious winter outbreak at any time.
And the Education Ministry also had an announcement on Sunday that it will designate a 2-week special virus prevention period for students taking the National College Entrance Exam, or Suneung. So this period will begin this Thursday and will last until the day of the exam, which will be December 3rd. And that to minimize any impact on students, on test takers, including those who've actually tested positive for COVID-19.
I see. So meanwhile, as I mentioned at the start, the US is struggling to stem its spread.
Yes, Sunny, the U.S. has reached over 11 million total cases, which means it took just 6 days for another million people to be infected, while it took 10 days from 9 million to 10 million. Also on Sunday, there were over 69,000 patients hospitalized, the highest figure ever. If we take a look at the countries with the highest caseloads, with the U.S. currently at over 11.3 million, 1 out of 5 cases are stemming from the U.S., and experts believe it may see soon 200,000 cases daily. Now we have India at 8.8 million, which is a country we will go into in depth later in the program. And also we see that Mexico here over the weekend has surpassed the 1 million mark. And in total, the world now has 54.8 million infections, with over 1.3 million fatalities. And those are the figures I have for now, but I'll be back with more updates on the domestic front from the government briefing. Back to you, Sunny.
All right, so thank you for that. Right, back on the local front, efforts continue to ease the workload of delivery workers amid the pandemic, especially in light of at least 10 losses of lives this year alone following daunting work schedules. Now, one such effort involves self-driving technology. To take a look.
Package delivery workers here in Korea are struggling to meet demand and working long hours amid the explosive surge in parcel volume due to COVID-19. Some 1.6 billion packages were delivered between February and July of this year, 23% more compared to the same period last year. The industry is forecasting parcel volume to reach 3.5 billion by the end of this year, up 30% from a year ago. Korea's National Postal Service has come up with new solutions to keep up with surging demand and take some of the burden off its workers' shoulders. They include mobile post offices inside autonomous self-driving vehicles, as well as delivery robots. Since late October, Korea Post has been testing a contact-free delivery system revolving around autonomous vehicle technologies.
코로나 대비 비대면이라든가 그다음에 전자상거래 가속화에 대비한 그러한 그 정보통신 융합 서비스 기술 개발 프로젝트 일환입니다.
The self-driving mobile post office can process and deliver mail or packages. Users can make a reservation via mobile app and are given a barcode that can be scanned at a kiosk inside the mobile post office. After an item is placed in the storage compartment of the vehicle, it is ready for delivery.
요즘 코로나19 시대에 사람을 접촉해서 이렇게 택배를 보낸다는 게 매우 조심스러운 일인데 제가 이렇게 직접 찾아가지 않고도 사람을 접촉하지 않고도 지금 이렇게 코앞까지 찾아와서 직접 이렇게 택배를 이렇게 붙일 수 있어서 매우 좋은 기회인 것 같습니다.
The self-driving mobile post office is the first of its kind seen anywhere in the world, a testament to Korea's technological strength.
자율주행 무인 우체국은 그 이종 기술 간의 융합 복합 기술이라고 말씀드릴 수가 있습니다. 기존의 자율주행 기술은 2010년도부터 시작이 됐지만 또 무인 우편 창구 관련해서는 약 20년 전부터 우편 자동화 기술 구현이 계속 이루어져 온 상황이고요. 그런 것들이 그 경험과 기술들이 축적된 것들이 잘 조합되어서 이렇게 구현이 됐다고 말씀드릴 수가 있습니다.
Korea Post is also developing a robot that can deliver packages to specific indoor locations. When commercialized, the robots will cover the final leg of the delivery process in places like a university campus or a large apartment complex. This is a robot assistant for delivery workers. It acts as a mule for the human couriers, carrying heavy loads and reducing manual labor. So when can we expect to see a wide adoption of these technologies, and what changes will they bring to our daily lives?
이러한 그 무인 우체국 서비스가 일생활에 도입이 된다면 소유자 중심의 우편물을 접수하고 배달할 수 있는 환경이 제공되기 때문에 고객 입장에서는 굉장히 편해질 것입니다. 또한 이제 고중량의 우편물을 운송하고 그리고 손이 많이 가는 그런 라스트 마일에서의 배달 일부 업무를 대체할 수 있기 때문에 우편 종사자들에게도 안전사고를 줄이고 근무 환경도 개선될 거로 봅니다.
It is hoped that unmanned postal services like these will help ease the burden of the country's delivery service workers.
Right, it's a little after 2 in the afternoon here in Korea, and we are poised to join the regular briefing on COVID-19. Sporadic infections emerging from private gatherings and public places nationwide are raising much concerns, especially ahead of the winter season, the National Scholastic Entrance Examination for college, and Christmas celebrations. As Soa reported earlier, Korea has been witnessing a steady rise in daily cases from this past weekend, with 205 cases on Saturday, 208 on Sunday, and 223 today. Now, under the current social distancing level 1, members of the public are simply required to abide by personal hygiene regulations, such as the wearing of face masks and the avoiding of large crowds of more than 500 people. A hike in social distancing to level 1.5 will seek to regulate gatherings of 100 or more people. Let's now take a look at the revised 5-tier social distancing guidelines as we wait for the briefing to commence. Up on the screen, we first share with you a brief definition of each level. Level 1 refers to sporadic infections that are within medical capacity. Level 1.5 refers to community infections that burden medical capacity within a certain region for a week or more. Level 2 refers to serious outbreaks within a community that look to spread nationwide, while Level 2.5 refers to a nationwide outbreak that threatens healthcare systems across the nation for a week or more. Level 3 refers to serious nationwide outbreaks that are poised, to crash the nation's healthcare infrastructure. With regard to the actual numbers of daily cases, the ceiling that determines the level of social distancing seems to have been raised, but officials have claimed the new guidelines aim to ensure an effective and an endurable, if I may, fight against the virus. Level 1 will be issued when cases hover below 100 in the metropolitan region, below 30 in other regions, and below 10 in Gangwon province and Jeju Island. Now, previously, the ceiling was sternly set at below 50 nationwide to allow for Level 1 guidelines. Meanwhile, Level 1.5 will mean the number of daily transmissions has surpassed the ceiling set under Level 1. Level 2 will be put in place if daily infections hit 300 and above nationwide for a week. The other two conditions for Level 2 include a week-long daily infection rate of more than 100 in the metropolitan region, that is. The briefing is about to start. We'll come back to you afterwards.
정경 청장의 설명이 있겠습니다.
Let us now begin our regular briefing on the COVID-19 response here in South Korea. As of November 16th, Monday, we have a total of 193 new local infections and 30 new imported cases have been reported. The total caseload now stands at 28,769. Currently, we have 2,516 people in quarantine undergoing treatment, and there are 55 patients with severe or critical conditions. We had one additional fatality, with the death toll standing at 494. I extend my deepest condolences to the deceased and the members of the bereaved family. Let us now take a look at the updates on major domestic infections by region in relation to a club activity in the Seoul metropolitan area's art school. We also have the first index case being confirmed. A total of 13 cases have been confirmed, and in total we have 14 cases in total. And in Gangwon province, Cheolwon district, in relation to a nursing hospital for the disabled, we have 5 additional cases being confirmed. In total, we have 11 cases to date. And in relation to a prayer center in Eumseong County in Chungbuk, we also have 9 additional cases being confirmed. A total of 10 people have been confirmed to date. And Gyeongbuk region, we also have a family gathering in Cheongsong region, and also we have the first index case identified this month, and we have a total of 19 cases being confirmed to date. And 15 were from Gyeongbuk region, and also 1 from Daegu and Seoul as well. And in relation to restaurants in Chuncheon City, we also have additional cases being confirmed, and so far we have 6 people being confirmed to date. And next, we would like to look at some trends of the outbreak as well as the risk factors. And during the past week, we also have a daily average of 120.4, which is about an increase by 34 cases from the previous week, which is an increase by a high portion. And we also seen the sporadic outbreaks and the imported cases coming in from various regions. And we also have the imported cases increased by 6.8 cases compared to a week earlier. And it stands at over 24. And when you look at the sources of infection, we have about 30% which are cluster infection, and about 24% are contact with the previous confirmed cases. And we are also seeing confirmed cases stemming from family gatherings and family meetings as well. And as for the imported cases, we have about 18% of the total cases stemming from foreign countries. And we have about 15% of the cases which are under investigation, and also there are 8.8%, which is about 93 cases in total stemming from hospitals and nursing hospitals. This is a slight drop from the previous week. In the past, we have seen cluster infections centering around the metropolitan area, and it was concentrated in some group of people and cluster. However, currently we are seeing various cluster outbreaks sporadically across the nation. And so we are seeing some changes of the latest trends, and also with the increase of travel and social gathering as well as family gatherings, we are seeing more related cases stemming from these meetings, and we also have a higher risk of community transmissions. And together with the risk factors stemming from the winter season, we also have a high risk of a nationwide outbreak. And looking at the age group, we have about 50% of the cases under the age of 40, and we are seeing a continued increase of these cases as well. And for the past 4 weeks, we have seen that 39.1% were also the people who were under the 40 years old, and we are seeing a continued increase of these age groups. And during the past week, we had 15 fatalities, and as for the age group, we have 9 people in their 80s and 2 in their 70s and 3 in their 60s, and most of them were above the age of 60, and also 86.7% had underlying illnesses as well. And for the fatality rate, those above the 80, we have about 21%, and about 6.8% fatality rate for those over the age of 70. And looking at the regions in the metropolitan area as of yesterday, we also have some updates. We have 99.4 cases on a daily basis, and this is nearing the threshold of the elevation of the social distancing measures. And also in Gangwon-do province, we have 13.9 cases, which is also over the threshold of 10 on the increasing of the social distancing level to 1.5. And we are conducting continued discussions with the local governments. And as for Jeju, Chungcheong, and other Gyeongnam and other regions, we also seen that the criteria has not yet been reached for these areas. And next on the influenza outbreak here in Korea, for the 1st of November to 7th of November, which is the 45th week, we have seen that out of 1,000 the patients, we have about 30 cases of the influenza virus. However, we have 3 cases out of every 1,000, and it is slightly lower than the on-year average of 5.8 cases. And we are also collecting the samples of people with respiratory diseases and symptoms, and we have seen 109 samples that have been collected, and none of them had influenza virus. And we have seen other viruses, including a rhinovirus, which also is categorized as a cold. And we also can see that this cold symptoms are spreading across the country, and we are seeing continued reports of these viruses. And from the 5 designated hospitals nationwide, we also seen the proportion of the influenza virus being identified. And during the past week, the early first week of November, we had about 0.2% identification of the influenza virus, which is about 5 cases. And we have seen both of the virus strain A and B. And the quarantine authorities are also continuously taking into account that we are having the large outbreak of the influenza virus from November to December. So we ask all of the public who has not yet get the flu shots to get their flu shot as soon as possible. And we are also providing our guidelines as well as influenza-related information so that we can increase the public awareness on these viruses as well. And please note that COVID-19 and influenza virus has similar symptoms, and there are many cases for the doctors to have difficulty in distinguishing these two viruses. So we have measures given the guidelines for the medical hospitals, and we would also like to make sure that the hospitals also check the patient's temperature as well as other symptoms, and also they can either have the physical diagnosis, or they can also guide them to go to the screening center for testing as soon as possible, or they also have the option of a remote diagnosis. diagnosis. And when you are going to these hospitals, if you have related symptoms, you need to always wear face mask and always keep your hands clean as well. And it is very important for the hospitals to guide their patients to abide by these quarantine measures. And when they are at hospitals, please be aware of any other actions that could increase the travel of the respiratory droplets. And also, if there are such cases of a diagnosis, please wear your protective equipment. And these are included in the guidelines as well. And if you are suspicious of influenza and you cannot carry out the testings at the hospitals, we are making sure that starting from 19th of November, they can prescribe more antibiotics for these patients. And also, even there is no warning against the influenza, we are having a wider coverage of the national health insurance for the antibiotics as well. And if we have an increase of the influenza outbreak, we will also expand the coverage of the health insurance to include not only those in the high-risk group. And also, after diagnosis, if they are in need of the COVID-19 testing, we will also enable them to give out related documents so that they could go directly to the screening centers and get tested without delay. And this is a way out to streamline any unnecessary procedures. And when the doctors are prescribing the antibiotics, if after even 24 hours, if the symptoms do not fade, we also need to be suspicious of the COVID-19. And in this case, we are also guiding these patients to go to the screening clinic to get tested as soon as possible. And also, we are asking for them to go back to work or school after this 24-hour period. And also, the quarantine authorities are noting sporadic infections outbreak of the COVID-19, not only in the metropolitan area, but also in other regions. And this is why we are continuing to exert our vigilance. And we also carry out and continue to note the public to partake in social distancing measures as well. In particular, we know that there are many year-end holidays, and we have increased physical contact with others and with many people. And there are also increase of indoor activities and lack of ventilation indoors. And we could also have a higher risk of infection. And there are many other risk factors like the colder weather as well as possible influenza outbreak as well. And in order to decide the elevation of the social distancing measures, it is a very critical moment that we are here right now. And it is very important that you continue to abide by quarantine measures and go get tested as soon as possible if you have any symptoms and comply with quarantine measures at all times. And at the events that are difficult to wear face masks, please take particular precautions at these events. And these also include indoor sports clubs as well as cafes and eateries as well. And so please also take particular precaution. Thank you very much.
지금부터 기자님들 질문에 답변 드리는 시간 갖겠습니다.
Right, that was Chung Eun-kyung, Commissioner of the Korea Disease Control and Prevention Agency with Monday's afternoon briefing. So what did she have to say?
Well, let's first examine the average figures from the past 7 days. 122.4 cases were reported on average, and that's up by 33.7. And that goes for domestic transmissions. And also the number of imported cases has risen by around 6 to 28. And it's not only the Greater Seoul area that is seeing a rising number of cluster infections, but the trend is that these cases are sporadically spreading to other regions as well. Tong mentioned the higher risks of a nationwide spread due to the colder season coming up. That's also why the number of influenza patients has risen as well. Now, the question now is, will the metropolitan region and Gangwon-do province lift their social distancing measures to level 1.5? Tong said that government officials are in discussion because Seoul, the metropolitan region, had 99.4 cases on average in the past week, while a number above 100 means 1.5 measures. And Gangwon-do province already has 13.9 cases on average in the past week, which is more than 10, and 10 is the criteria from 1.5 in that region.
Right. Okay, so thank you for that. I'll see you again tomorrow.
See you tomorrow.
Right, on the international front, Diwali celebrations in India this past weekend took place amid heightened COVID-19 concerns as the city-state of Delhi has been recording a disturbing number of daily cases in recent days. Now, for more on this, I have Dr. Amitabh Arya, that is, from the Sanjay Gandhi Postgraduate Institute of Medical Sciences, live on the line. Welcome, Dr. Arya.
Hello, 안녕하세요.
Annyeonghaseyo, Doctor. India's daily tally has been under the 50,000 mark, which is about half its record peak for more than a week. But the city-state of Delhi, as I mentioned, has been recording more than 7,000 cases per day in recent times. What is the current COVID-19 situation there like, Dr. Arya?
The main reason is now in northern India the winters have set in, and there is smog due to the pollution, and there's fog. So that is the reason that the virus cases have come up, because the virus is piggybacking on the pollutants, that is 2.5 PM, and it is acting as a carrier, the pollutants from the automobile exhausts. So definitely the cases are increasing, especially in Delhi.
I see. Dr. Arya, as I mentioned at the start of our corner, that is, more than 1 billion Indians partook in Diwali celebrations this past Saturday. Now, for the sake of our viewers here in Korea, please do tell us a bit more about this religious holiday.
Actually, Diwali is a celebration festival where people celebrate the returning of Lord Rama from exile after 14 years. And primarily it was, people used to display lamps and everything. Crackers came up recently, just a festival of joy and colors and light. But the problem this time is many states banned it. In fact, my state where I live, Uttar Pradesh, had totally banned it. So except for very few people who sporadically use the firecrackers, most of the places did not use firecrackers this time.
I see. Doctor, what other measures were in place to curb the spread of COVID-19 during this year's celebrations?
Yeah, basically social distancing, use masks, go out when it is definitely needed. But people sometimes definitely in festivals become over enthusiastic. They go more often to meet their relatives, go to festival shopping. So definitely there was more of people going around for shopping and all. But definitely, I think except for Delhi, no other place in India has seen such a high rise of cases. As if you see, we have 28 states and 9 union territories, out of which only 9 states there have been increase in the number of COVID cases this winter.
I see. Dr. Arya, I understand that aside from resurgence concerns, there are also mounting fears, as you mentioned, over rising air pollution in the region. What are your thoughts on the link between pollution and the pandemic?
Air pollution definitely will increase the cases as we are expecting, especially in northern India, where we have a cold weather has set in. Because in southern India, we don't have cold weather. So definitely northern India may get affected, but government is trying its best to control it. And we hope with this way, we will be able to control. Definitely automobile exhausts are a big problem in big cities, especially in Delhi, which has a lot of number of automobiles, cars, two-wheelers. We hope, I think, by government strict measures, maybe we'll be able to control the pollution. And if pollution is controlled, definitely the number of cases shall be controlled, because government is on a policy of tracking it by doing the various tests and to contain it somehow. And we hope this winter we'll control it.
Right. Dr. Arya, before you go, please do share with us the latest on zero surveys in India to estimate the prevalence of COVID-19.
Can you repeat the question, please?
Yes, a little bit on your thoughts about the zero surveys in India to see the prevalence of COVID-19.
Because we are doing a lot of tests. In fact, India till 13th November, we have done 123 million tests. And we are doing it on a regular basis in the private hospitals and government hospitals. And we hope we will get the test, because right now we are having a survey of every state, but we don't have the results right now of the tests.
I see. All right, Dr. Arya, as always, thank you very much for your time and your thoughts.
Thank you. 감사합니다. 감사합니다.
한국은 지금까지 형편이 되는 대로 진단 키트와 마스크를 비롯한 방역 물품을 나눴고 드라이브 스루와 워크 스루 같은 K-방역의 경험을 공유했습니다.
Regional talks on peace and prosperity came to an end this past Sunday with a comprehensive accord on economic partnership, as well as enhanced efforts to fight the pandemic. Now, for more on these intentions, I have Dr. Lee Jae-hyun from the ASEAN Institute for Policy Studies. Welcome to the show, Dr. Lee.
Thank you.
And I also have Dr. David Kwak from Soonchunhyang University Hospital. Good to see you again, Dr. Kwak.
Good afternoon.
Dr. Lee, would you say that the significance of the virtual ASEAN summit and broader regional talks this time around was the RCEP?
First, let me just go back to the end of last year, 2019. At the end of last year, we had Korea-ASEAN Special Summit, and the leaders from Southeast Asia and Korea made a lot of promises for cooperation. But due to this situation of COVID-19, the cooperation couldn't be pushed forward whole this year. And the significance of this summit is that the leaders from Southeast Asia and Korea, they reaffirmed their political will to push the bilateral cooperation ahead. That's first. And the second thing is that the President Moon Jae-in unveiled what I call New Southern Policy Plus this time. It is an upgraded version of New Southern Policy. And you just mentioned the RCEP. The RCEP is a regional free trade agreement. Total of 15 countries are in. And as you know, due to the COVID-19 situation, the international flow of goods and service is extremely difficult at the moment. And it had a significant impact on individual economies. And with this RCEP, we hope that the regional flow of goods and service will revive in the coming years.
Right. Dr. Kwak, what is the general assessment of the COVID-19 situation in the ASEAN member states?
So I looked up the daily briefings of the countries that belong to ASEAN Committee. There are a total of 11 countries, as everyone would know. But especially some of the countries actually were distinguished than others in their increase in the daily cases numbers, such as Indonesia currently showing above 5,000 daily cases, and Philippines also showing very high numbers above 1,000. And then there were two other countries, Myanmar and Malaysia, that showed actually lower and thousands of numbers increasing. They were also, those four countries were also showing a very high mortality rate in regards to taking care of their own patients. But other countries such as Thailand or Vietnam and Laos probably, they were actually showing very low numbers, daily cases numbers, such as from 0 to possibly, I believe 13 in Singapore, or so I can't. My memory is really bad right now. But so I think the differences in numbers that we're noticing is primarily due to the infrastructure, especially for the medical care in their own countries. Also, the measurements they are currently taking, it seems like political aspects are taking in places of those who are vastly increasing in their numbers. So those are some things to consider. On the other hand, countries like China, Japan, and Korea showed also very distinguishing numbers, such as in Japan, they're now seeing numbers above 1,400, but in China, they're claiming to have only 8 plus the daily cases at the moment.
Right. And Dr. Lee, as a pundit on Southeast Asian affairs, what are your thoughts on the region's medical infrastructure in response to the pandemic?
Already Dr. Kwak mentioned, explained quite details of the situation, COVID situation in Southeast Asia. But some countries like Philippines and Indonesia, the most populous countries in Southeast Asia, they have a serious problem at the moment. And the total confirmed cases are more than 400,000 so far, which is such a big number. And there are 15,000 and 7,000 deaths respectively in those two countries. And the testing and tracing is the easier part, I guess, but the treatment is quite different. So due to the poor medical infrastructure, the treatment in these two countries are not going very well. So that partly explains the high mortality in these two countries.
I see. Dr. Lee, from the start of his term in office, President Moon Jae-in has stressed the importance of Korea's ties with its Southeast Asian counterparts. How do you assess the current bilateral ties between the two?
Despite this COVID-19 situation, there's, as I mentioned, the political will to further our bilateral cooperation between Korea and ASEAN countries. But as you know, the COVID situation put restrict on the people's movement, which is vital for the socio-cultural cooperation as well as economic cooperation. There's both dark side and bright side. For the dark side, as I just mentioned, the restriction on the people's movement, socio-cultural cooperation is not going very well. And the people cannot go around between Korea and Southeast Asia. And the bright side is, though, we expected substantial decrease of our bilateral trade volume, which is not true. The trade volume maintains its level, last year's level, and there is only slight decrease in trade volume. So the goods still flows between Korea and Southeast Asian countries. And the other bright side is that thanks to the COVID-19 situation, the South Korean government had a bit more time to think about its strategy, cooperation strategy towards Southeast Asia. So one of the products of the time that the South Korean government had is the New Southern Policy Plus initiative just unveiled.
Right, which I'll ask to you about later on. Dr. Kwak, President Moon Jae-in has also called for a system of transparent and prompt interaction between Korea and the ASEAN member states in the health sector to ward off future diseases. What are your thoughts on such interaction?
Well, obviously, it'll be very important, not just in the fight against this particular virus, but any future infectious diseases or any other diseases to come in the future. As you've seen through the COVID-19, this is a global matter, and many of the other diseases are currently becoming global matters. And those countries with whether weaker infrastructures, medical structures, would suffer definitely way drastically than those countries who are more advanced in the medical infrastructure. So coalition would, I agree with the idea that coalition is very important in handling those future possible cases. But not only that, sharing of the knowledge, sharing of the information is as in what to come. As you're seeing currently through the global news, we are now at the verge of getting the possible vaccinations to everyone. I'm not just talking about the ones from the US, but many other countries are also coming up with their own vaccines. And to my knowledge, Korea is also underway of developing one. So if we come up with these many different types of treatments available and vaccinations available, not just for COVID-19, but for other future medical purposes, it is best to always to share and treat globally. But also in the cases of COVID-19, we've seen that global infection rate has affected other neighboring countries. As we've seen from the Itaewon cases and possible European countries, the numbers actually transfer to the neighboring countries. We got our numbers from possibly from the influx from other foreign countries. So if we don't treat in a cooperative measure against a certain disease, sooner or later it is going to affect in a very drastic way. So I believe that global coalition would be a very important footstep that we need to make.
Right, and speaking of such collaboration, the president also spoke of a $10 million aid for vaccines for developing countries. What is the significance of such aid for these nations?
Well, personally, because I'm not an economist, I wouldn't be able to put an exact estimate on the impact of that particular number. But it is a very symbolic movement in our part because, as I mentioned before, those countries who are less structured in medical sector, they're without any help or measures to fight against this COVID-19. They won't be able to just go ahead and get the vaccines they want because they might either lack money or they might lack personnel or they might lack even the system. If other countries around them don't help those in need, they are, as I said before, they are eventually going to get affected from that particular situations and effects. So I believe our government has made a very good symbolic gesture in claiming to, making plans to invest such money for the less developed countries.
Right. Dr. Lee, the ripple effects of the pandemic have been extensive to say the least now. What changes do you forecast in ASEAN member states amid and hopefully after the pandemic?
We can imagine so many changes in the post-COVID-19 situation, but let me just focus on my expertise, international relations. As you know, the COVID-19 situation made the bilateral relation between the U.S. and China worse, and there is a strategic competition, technology competition, the trade war, and now even people are talking about the ideological fight, the dispute between the U.S. and China. Maybe we can expect a new administration in the United States, Biden administration, but the superpower rivalry wouldn't go away. It will be there, still there. In the post-COVID-19 situation, the ASEAN is positioned in a very interesting kind of location between the U.S. and China. And both these two superpowers in their rivalry, they want to get or win over these Southeast Asian countries. And they have kind of strategic leverage against U.S. and China. And as far as South Korea is concerned, we are facing the same dilemma, like a choice between the U.S. and China. And the bilateral cooperation between Korea and ASEAN will increase South Korea's strategic leverage against these two superpowers, and it will be really helpful for South Korea to navigate in this turbulent situation, situation of a rivalry.
Right. Dr. Lee, I'd like to touch upon what you mentioned earlier, that President Moon, as you mentioned, has upgraded his initial initiative for Southeast Asia. It was called the New Southern Policy, as you mentioned. It's now called the New Southern Plus strategy, so to speak. What is the difference between the first one and this latest one?
The core of a New Southern Policy was what we call so-called the 3 Ps: people, peace, and prosperity. These 3 principles are still there. But what we mean by plus is that the South Korea increased and doubled its commitment to make a meaningful cooperation with the ASEAN countries. And this particular strategy revealed 5 new directions and 7 new items. Already there are so many items of cooperation between Korea and Southeast Asia under the New Southern Policy banner. And these 7 initiatives streamlined those cooperation and put them in 7 different categories. 3 of them are social culture, and 3 of them are economic, and 1 non-traditional security. And particularly, the medical and the health cooperation got the highlight in this among these 7 initiatives. And the government, South Korean government is quite determined to provide some fund for Southeast Asian countries to fight against COVID-19, as well as in the long term, South Korea will double its ODA, health ODA to Southeast Asian countries by 2025. And it will mostly spend on the hospitals and the capacity building for medical workers in Southeast Asia.
I see. So Seoul is looking to foster productive ties with the region then. Dr. Kwak, leaders at the regional summit have also called for fair distribution of COVID-19 vaccines. Now, what impact do you see such calls, such efforts as having on future global collaboration in the fight against the pandemic?
Well, rather than making a prediction, I'm going to make a statement about my hopes for what's going to happen. Well, we need to be able to distribute the vaccines more equally. Obviously, those countries that came up with their own vaccines is going to have much more advantage over the other countries because they would be able to provide themselves with the vaccinations and hopefully or possibly get over with the COVID-19 much sooner than the other countries. It doesn't mean that they have to all help others in the current global situation because, as I said earlier, it affects globally. But if we don't distribute the vaccinations as equally as possible, it's really going to affect only a certain part of the world, and the other part of the world is going to still suffer and is possibly will wave back to the countries, those who are maybe not so much vaccinated even within those advanced countries. So I believe that not only in the cases of Korea or any the neighboring, the vicinity or neighboring countries, but for the whole global world, we really need to get all the vaccinations gathered possible and distribute to all the affected countries as equally as possible, but not only those, to the ones that need them the most first, probably with the most affected countries such as we've seen here, possibly Indonesia or Malaysia or other countries that are very heavily affected at the moment.
Right. Dr. Lee, perhaps you could end today with a few words on your thoughts of the impact of the regional comprehensive economic partnership on Korea.
Mm-hmm. Many people say that this RCEP is led by China, but it is not true. It is led by Southeast Asian countries. The initiative came from Southeast Asian countries, and in the whole 8 years of negotiation, Indonesia has been the chair country of negotiation. So definitely it's about ASEAN, not China. And the South Korea cooperation with Southeast Asian countries, we invested a lot in this RCEP. And we are experiencing some economic difficulties, especially South Korea is quite dependent on international trade. So this RCEP will be definitely helpful for South Korea to overcome not just COVID-19, but overcome the economic impact of COVID-19. So I had great hope in this free trade agreement.
We'll keep our fingers crossed. All right, Dr. Lee, thank you very much for your thoughts. And Dr. Kwak, as always, thank you for being with us today.
Thank you.
Right, well, that brings us to the end of this edition of COVID-19. Be sure to join us tomorrow at this hour. In the meantime, do take care and thank you for watching.
Throughout the almost a year-long COVID-19 outbreak, we've come to minimize direct contact with others and turn to contactless options. Traveling is no exception. What's gaining in popularity these days is camping, especially what's known as tabak or car camping.
The camping industry is thriving despite the COVID-19 outbreak. And among the camping options available, the current trend is car camping. Known as tabak in Korean, this newly coined term combines the words cha or a car and spak, which means accommodation. All you need is a car. You're free to come and go